Hey everyone, welcome to a wonderful session. We're really excited to have an insightful conversation about increasing access to veterinary care for vulnerable populations, a solution-focused panel discussion. My name is Dr. Adam Christman, Chief Veterinary Officer here for DBM 360 and the Fetch conferences, and we're so delighted to have you joining with us. And we have a great panel discussion lined up. So how do we increase access to veterinary care for vulnerable people and animals? All right, so we're going to talk a little bit about the crisis of access to care right now. So the crisis of access to care needs to be addressed like now, and we'll take collaborative partners with creative solutions. So it's estimated, get this, you guys, that over 50 million pets can't get access to veterinary care. I'll say that one more time. 50 million. This means 1 in 4 are unable to get the care that they need, with 97% of families considering their pets to be family members. Hey-oh, it's awesome. We need to rethink care options to include all in the bonded family. So Open Door Veterinary Collective is a national nonprofit dedicated to increasing access to veterinary care through training, consultations, program development, and of course, research. Open Door has rocked the world of ABC and is bringing many minds together to create solutions and break down barriers. So joining us is Dr. Kristin Jankowski. How are you, my friend?
Great. Thanks for having me.
My pleasure. A little bit of information about our wonderful colleague here. Dr. Jankowski is the Director of Veterinary Services at the Open Door Veterinary Collective and an Access to Care veterinarian at the UC Davis One Health Institute. From 2020 to 2023, she served as an assistant clinical professor of small animal primary care at UC Davis Veterinary Medical Teaching Hospital. And prior to 2020, she worked in general practice, specialty rehabilitation, and was the creator and director of One Health Delaware. That's awesome. So congratulations on doing that, by the way. It's amazing.
Thank you.
Okay, so my question for you, my friend, how do we increase access to veterinary care for vulnerable people and animals?
It's a complicated solution, and thanks, Dr. Christman, for the great question. But the first step is, of course, always establishing trust. It's an easy first step in some ways. You just need to start by listening to individual needs and concerns of each client-patient pair, working together as a team to find solutions that fit. And I like to think of it as being part of the care team. The client always knows their pet the best. And as a veterinarian, our job is to share information and resources and really help them feel empowered to select what works best for them in their individual situation. The next part of helping the vulnerable people and animals is knowing how to use a spectrum of care approach. And that word's being tossed around, that word and phrases of words has been tossed around a bunch, but it's really only recently been defined in our profession, even though the concept has been around for decades. And it means providing a continuum of quality care options, that these care options are responsive to the client needs, their expectations, and their financial situations. In simple terms, it really just means meeting the clients where they are. The other cool part about spectrum of care is that we use evidence-based medicine to support our plans, and we're lucky to have more and more research coming out each year. When I was in private practice, I started to notice that there was less focus on the client's needs and goals and a bit more emphasis on recommending the highest technology test or treatment. And I actually saw the same, issue happening when I was teaching veterinary students. When faced with a challenging case or barriers to care, instead of feeling creative, the vets or vet students felt lost or distressed. And don't get me wrong, the vets and students still wanted to always do right by the clients, but they were fearful, afraid of litigation or failing how they were trained in vet school. And so the great part is we have so much more information to share now about spectrum of care. And that spectrum of care is nothing to be afraid of. And it's good, solid medicine. More and more support is coming out at the level of vet schools too, in addition to certified online training opportunities like we have at Open Door. It's been encouraging to tell the current vet students that they're part of a generation working to redefine case success. As the colleges of veterinary medicine shift to provide more training on spectrum of care and financially friendly payment options, we can all enjoy our work more and still pay our bills at the same time, because we all know we need to do that, and we don't need to be giving these services away for free to make it work. It's pretty amazing that just by listening to our clients and developing these, unique care plans that we just have to thoughtfully work together, we can help our clients, our patients, and even ourselves at the same time.
Yeah, really well said. We really can help everybody. Everybody wins when we talk about it. And I do think sometimes it's like changing your mindset a little bit. Sometimes we've been doing this for years. We just didn't know we were calling it spectrum of care to your point. So I think it's really a good reminder of the different types of spectrum of care within of what we're doing in our profession. So yeah, awesome. And core veterinary expertise and is such a great way of offering that continuum of options to find the most actionable and affordable care solutions. We could do this through proactive collaborations with our human clients. I love to listen. Proactive listening or active listening is so important to understand their unique expectations and financial abilities. I think being transparent in the exam room with your veterinarian and seeing what you're capable of doing within your financial resources, I think is another great win. So that way we can all be aligned at the same time. So all that, and it can help us to enjoy our jobs too. And that's a great combination. Okay, friends, so let's hear now from longtime social worker, Dr. Janet Hoy-Gerlach, who can speak more to those working on the human side of the lease. A little bit of, how are you, my friend? How are you, Dr. Janet?
Hello, I am doing great. Thank you so much.
Yeah, we're so honored to have you join us too. This is a great conversation we're having here. So a little bit of information about our friend, Dr. Gerlach. She is a licensed clinical social worker, author, and human-animal interaction researcher with extensive experience in mental health services, including crisis intervention, therapy, stress outreach, and program development. She's the director of veterinary social work at Open Door and lead author of the book, Human-Animal Interaction, a Social Work Guide, published by the National Association of Social Work. Her research on human-animal bond benefits has been featured in Discover Magazine, Business Insider, and Psychology Today. And she serves as an expert witness on such benefits for the U.S. Department of Justice Civil Rights Division. My goodness, you're busy, huh?
We all are, I suspect.
Well, it's great work you're doing. It really is. Okay, so how do we increase access to veterinary care for vulnerable people and animals?
Yes. As you mentioned earlier, the majority of U.S. households are reporting they have companion animals, most of those saying that their animals are family. At the human side of the social work practice, a basic tenet is starting where the client is at. And I love how listening to clients is already, just listening to Dr. Jankowski and to you, Dr. Christman, is such a key element. And pulling that forward, that's a place where I think human healthcare and social service providers have work to do to help increase access to veterinary care. Despite so many folks having animal family members, the relationships people have with their animals are largely invisible in human health and social services. By that, I mean, we don't ask, we don't recognize unless something is sort of overtly brought to our attention. And certainly there's exceptions to that, but those are the exceptions, not the rules. So for human service providers, the first step to increasing access to care is to be sure that we are asking about pets. And there's really three simple questions. One, do you have or live with animals? And then if so, tell me about that. Two, are those animals helpful for you? If so, how? That helps us to get at, the animals as a support, a strength for the person. And three, any stressors or worries about your animal? If so, what? And then listen deeply. And while those of you who are here with us today, listening to each of us, my guess is you're all doing a lot of this already. The next step then is to get our organizations on board so it's not left up to the individual clinician or provider to have to remember and do that. A simple step toward that is to get those questions about human-animal relationships built into your front door agency form. So what are those? Your triage, your intake, your assessment, your admission, any information gathering forms that You know, you can put those questions there. I've seen, who do you live with? You know, works for some organizations or institutions, but really wherever it makes the most sense. And adding these questions, essentially it institutionalizes inclusion of you know, the human animal relationship. And by that, that's like a fancy word for, it makes it part of the routine practice. It's no longer left up to individual practitioner discretion. It's built in. We can't forget it. It's right there to ask. And then once those questions are asked, we can then recognize and respond and refer. You know, we're not animal experts, those of us that, you know, are professionals on the human side of the leash, unless, you know, we're cross-trained. However, we routinely link folks to needed resources. We help partner and build resources. We advocate when there's barriers to resources. Access to veterinary care, no different. And if we're not sure where to start, you know, we've asked, we've responded, the situation's in front of us, what are the resources? Open Door has pethelpfinder.org, which is a searchable database for resources such as temporary foster care in emergencies, pet food banks, financially friendly, accessible vet care, and transportation's another barrier. Partnership with U-Transport, you can find information there. So the resources are there, and animal welfare sector organizations can be incredible partners, but the first step is to ask. Helping people and pets access veterinary care starts with asking. If we don't ask, we don't know. If we don't know, we can't help. On your screen, you see the social work human animal resource hub. It's being built on Open Door. It's still in process, so stay tuned for more on that. And I'd like to conclude with showing you a brief video that gives you more information about pethelpfinder.org as a resource.
That's such a great video. Thank you so much, Janet, for sharing your expertise with us. I got to tell you, I made a video for the website, pethelpfinder.org, and the amount of pet owners that actually went to that already, just from, I'm just saying from the video, but just in general too, that reached out to me, I thought it was profound, not knowing that that was available, but now that they have access to certain veterinary care, this has been a game changer. So I want to give pethelpfinder.org a huge shout out, because as a veterinarian, it means the world to all of us from the profession. So thank you so much. Human service providers aren't expected to be animal experts, rather you're critical partners in supporting the human animal families, and can be the human side gateway to helping access veterinary care for animal family members, which you've seen in the video. And I really do think that the first step must be to ask about pets, just to your point, and get some of those questions included in agency forms, which is really important as well. And so to maximize the access to veterinary care, Both the animal sector organizations and the human sector organizations have crucial roles. So let's now hear from Heather Camisa, an expert in strategic partnerships between animal and human sector organizations. And P.S., we have known each other. We're not even going to tell them how many years we've known each other, Heather, but she's a wonderful human being. So how are you, my friend?
Oh, it's so good to be with you, Adam.
Wonderful. Thank you. So a little information about Heather. She has 25 years of experience in community animal welfare, innovation, and mission impact, with more than a dozen of those years as the chief executive of 2 nonprofit organizations. She has a master's degree in economics from Rutgers University, and worked in both financial and social economics before devoting her career to the human ethic. She's a certified animal welfare administrator through the Association of Animal Welfare Advancement and is a certified animal control officer and animal cruelty investigator. She is a project leader for pethelpfinder.org and serves as chief enterprise officer for Open Door Veterinary Collective. So Heather, how do we increase access to veterinary care for vulnerable people and animals?
Well, while we don't need research to tell us the importance of strategic partnerships to impact vulnerable pet families, the good news for our case statements, for building organizational buy-in, is that the research does support how important this is. As an animal welfare professional, as you shared for a long time, who's developed a lot of community pet programming, I can tell you that it broke my heart when I conducted field research with Meals on Wheels pet families and found that only 16% of individuals receiving home-based nutrition services through Meals on Wheels had ever reached out to a humane society for help. 16%. And that's just too low. We need to all leverage our expertise and reach so that together we can reach the maximum number of people and pets possible. And to do that, we really need to listen and learn from each other. We need to understand the constraints that everyone operates under. Some of the social service agencies in our communities, just like animal welfare, may be structured differently community to community. Sometimes they're municipally run. Sometimes they're a standalone nonprofit. Sometimes they're part of a larger nonprofit. And so, as Janet shared, we can ask the right questions and we can build those questions together, and then we can work on solving them together. And I'm a big believer in a memorandum of understanding. It's not a formal contract. It's usually easier to get through no matter what kind of organizational structures we're dealing with. And it just really lays out how we're going to communicate with each other. What's the spirit of our work together? What we each bring to the table, and it assigns, again, points of contact, because we're working with people, we're working with animals, we're working with volunteers, and it can get messy. So, it's not just going to be when we're celebrating a press release or we're celebrating the good work together in the community, but also how we're going to navigate through wrinkles and corners when they happen, because by working together, we are just so much more powerful for our communities. So pethelpfinder.org was created to not only enable the public to find services, to enable social service agencies to find help for their clients, but also so that you can find partners with one another, and also that you can find programs that you want to flatter with imitation.
Thank you, Heather. Thank you for sharing that, all the great work you do. Leveraging our collective expertise across human and animal sectors to increase access to veterinary care requires those partnerships that start with deep listening and learning from each other. I think, we celebrate each other better through collaboration and innovation together than separate. So, actionable infrastructure to define and support partnerships such as memorandums of understanding. And Heather, I'm telling you, at MOUs, if you guys haven't done them before, I think that's a great way of pushing things through. It's a great understanding. So bravo on that point. Okay, so this takes us to a boots on the ground view with cross-sector community coalition expert Geraldine Silva, who has successfully catalyzed local networks of human-animal sector collaborations in communities internationally. How you doing, Geraldine?
I'm doing great, thank you.
Thanks for being here. A little information about our friend Geraldine. She is a consultant in human and animal welfare with nearly 15 years of experience supporting individuals in keeping their beloved pets. Currently, Maddie's National Director of Programs and Partnerships for Open Door Veterinary Collective. She also serves as a strategic advisor and mentor to Project Street Vet, an advisory consultant to California for all animals. Geraldine holds an MBA from Edinburgh Business School and a BA in sociology with a diverse background in mergers, community program development, research, advertising, and branding across 3 continents. Wow. Well, I can't think of anybody else better to ask this question, is how do we increase access to veterinary care for vulnerable people and animals in your perspective?
Thank you for that question, Dr. Christman, and I'm so happy to be here with all of you. So in the context of talking about increasing access to veterinary care, I think it's first crucial to talk about what we mean by vulnerable people and families. And also, it's important to recognize that vulnerability can affect any one of us at any time. So when referring to vulnerable people or families, we're actually talking about those people who are members of our community who are facing some kind of a crisis. It could be a life crisis, a financial crisis, or both. And often when they're in these situations, they're navigating the complexities of social services and human services just to get access to care for themselves. And if they have a pet, then they have the additional burden of trying to navigate resources to get help for their pets, just so they can stay together. And often, these pets are their only source of joy and companionship. So when these families come to us in their vulnerability, they come to us as whole people with whole problems, and they need whole solutions. And often, we're the only ones who are their last source of hope or comfort. So like Dr. Jankowski mentioned, we need to listen to their stories because often the potential for partnerships in our community lie with them in the conversations that we have with them. So let's look at the animal welfare sector, for example. Historically, the animal welfare sector has operated in silos with each entity, for example, private animal shelters, municipal shelters, rescue groups, private veterinary practices, dog trainers, and even organizations providing financial assistance with veterinary care operating on their own. But there's a huge opportunity to collaborate in different ways. You could layer on collaboration, you could scale out and scale up collaboration. So when we think about, for example, providing resources when people need help, and if we've exhausted all of the options that we offer, for example, at an animal shelter, we could create a referral guide, for example. We could use platforms like Pet Help Finder, like Janet and Heather mentioned, which is a great resource. But when we refer people to other veterinary practices or organizations giving financial aid, those could lead to long-term partnerships. But then again, we need to understand that not all partnerships need to be formal or informal, short-term or long-term. They can be organic and grow in the way that works best for the 2 organizations in that partnership. For example, in a financial aid discussion, when people are needing assistance with their vet bills, there are different organizations that help with financial assistance. So sometimes it might be that we just advocate for these people in need and pool in funds across organizations so that we might even be able to save a pet's life and keep a family together. Transportation, we found, is a huge barrier to access. And so Open Door has partnered with Uber to facilitate rides for guests in need. And you can learn more about the U-Transport program at opendoorconsults.org, and we'll be happy to talk to you through the process. So looking at the human welfare sector, they work separately and in silos as well within that sector. So we have social services, healthcare, housing, food assistance, homeless support, domestic violence support, schools and the local government, and so on. Yet there are so many opportunities for collaboration. For example, just attending a resource fair in the community, you don't even need to participate, or you could participate and set up a booth and share some information. You could take it a step further and collaborate with, say, health centers, and even adapt a One Health model where you could offer resources for the whole family unit in one place. There are opportunities to collaborate with even city council members if they have a portfolio or oversee a district in a low-income neighborhood or under-resourced area. They often have funding for welfare programs to help their community members. So you might be able to benefit from that funding as well. So it's best to just keep your options open, speak to your community members, have them represented in the work that you do, have bilingual speakers, and most importantly, start with your team. Because if you can build a collaborative culture within your team, have representation, and almost by default, have them think about collaboration as a way to help thriving communities, that's the best way forward.
I love that. I know when I was at some dog events, the amount of collaborations that just organically happen, to your point, is pretty amazing, right? Like, it doesn't have to be this solidified, pen to paper kind of a contract, but just might give a handshake thing. Like, how can we support one another to provide resources to our clients and the animals? And I love that you shared that. So thank you so much, Geraldine. Fantastic.
Thank you.
Yeah. And I really do think it starts with recognizing vulnerable pet families. And it could be you, me, at some point experiencing an economic emergency or a health crisis, and ask them what they need and proactively listen to them, and specifically listening for those subtle cues from them for potential partner organizations in human and animal service sectors. From there, we can reach out and begin to build cross-sector relationships, just like we were talking about, across animal and human services and silos and communities based on partnerships and trust. And the list just keeps going on and on. I always say my motto, my friends, is like, your network is your net worth. And this is exactly how it works with what we're doing here when we're talking about spectrum of care and access to care. So there is a spectrum or range of ways to collaborate, ranging from ongoing to single projects, such as local resource guides or a resource fair. And step by step, we can literally develop community-specific, community-led collaboration solutions. So I think that's just wonderful. So as we're wrapping up here, I really want to thank all of you and to our panelists for joining us and sharing your perspective and your expertise with us. It really means a lot. It's how we advance together. And this is a perfect example, you guys tuning in, of collaboration. Look at all the different perspectives we just shared with you. And it's such a great best practice on how you can model that moving forward. And increasing access to veterinary care is a multifaceted challenge that requires multifaceted and innovative solutions. And key themes across our panelist responses are listening to people with pets to hear their unique needs, and to collaborating across human and animal service sectors to help remove barriers to access and care. Heather Camisa mentioned that only 16% of seniors with animals ask for help. That is just way too low. So I know we could do better, and we have to do better. And if we think of the barriers to care as a couch that we need to lift, and we know it's tough carrying a couch if you're only lifting just one side. So we have, cross-sector collaboration from human and animal service sectors, and we lift both sides of the couch, and everybody wins. So for resources, check out Open Door Veterinary Collective's website. There are veterinary financial triage courses, pethelpfinder.org, like we just mentioned, transport information, and much more. On behalf of the panelists and myself, Adam Christman, thank you so much for joining us, and keep those eyes open and help us out. We'll see you next time. Take care, everybody.